Since 1930, a lot of people, a lot of organizations have been helped by the United Way of Greater Nashua.
Right.
Unfortunately, that's the good news. The bad news is there's still a lot of need out there.
Right.
There's still a lot of great programs that need the funding.
Right.
And to address that, you recently announced that you're investing nearly $1 million
Right.
to invest in the community and in programs. Can you
Right.
talk a little bit about that?
Sure. The latest needs assessment data tell us that there's 4 significant problems in the community. Lots and lots of problems, but 4 big ones caught our attention. The first is about a 30% increase in the rate of poverty in our community over the last decade. The second is that women in our community face about a 30% higher rate of domestic and sexual violence than in similar communities around the country. The third is about 60% of our community is obese or overweight. And the fourth is when you look at students in our high schools, the rate of substance use and abuse is really, really striking and scary for the future. Those 4 are important because they come together in a context that the CDC, the Centers for Disease Control, brought to the forefront about 4 or 5 years ago. They took a look at about 12,000 families out in the Pacific Northwest, and they studied the environment that those folks grew up in and looked at their success over the long term. And they found that children who were exposed to 4 or more, they called them adverse childhood experiences over the course of the first 18 years of life, lost about 20 years in life expectancy and had a direct correlation with early onset of chronic disease, mental health issues, substance abuse, risky sexual behavior as teens, incarceration, and so forth. And what the CDC found is these adverse childhood experiences, they identified 10 of them. They're things like divorce, abuse and neglect in the home, a family member with mental illness, a family member who is incarcerated or something. And they said most of the people they looked at had some adversity as they were growing up. But when you compiled 4 or more of these adverse childhood experiences over 18 years, that's when you saw this correlation with the early death and the early onset of chronic disease. So what we're really focused on is investing in the programs that work on breaking those cycles. Because if we can reduce the number of adverse childhood experiences that kids in our community face, those kids are going to grow up and be more successful, which is a good thing for them. They're going to be less reliant on public assistance and the agencies that are helping them now, which is good for all of us. And our community is going to be stronger. But it really starts with breaking the cycle. And the programs that we're investing in are the ones that are focused on breaking those cycles of abuse and neglect so that the kids in our community have a stronger chance of growing up.